My name is David Halsey. I'm an orthopedic surgeon who practices at Martha's Vineyard Hospital. I also have the privilege of serving as the president of the American Academy of Orthopaedic Surgeons. I chose to be board certified when I was finishing my residency because I knew I wanted to practice in an environment of peers in either in an academic setting or a partnership between private practice and academic. I needed that certification to demonstrate my commitment to lifelong learning. And if you don't rise to that level, then you're not going to be a part of that peer group, and I wouldn't want to start my practice off without that footing. The maintenance of certification part of it is one in which we need encouragement to stay up to date in our specialty and our subspecialty, and for some, our sub-subspecialty. And our jobs are very demanding. We have our own practice, we have our family, we have contributing in our community, so things can get stale over time. That's just human. So the commitment that we make and I make to maintain my board certification is so that I feel that when I go to work every day, I'm operating at the top of my license. Because I know that 5 years ago, that knowledge is probably half of it is a little outdated, and I need to stay up to date. And the process of certification and maintenance of certification really is a driver for me to just consistently honor that commitment to lifelong learning. So there are distinct differences between the American Academy of Orthopaedic Surgeons and the American Board of Orthopedic Surgery. So I have the privilege of being the president of the American Academy of Orthopaedic Surgeons, which is the educational arm of orthopedics. We provide the content, the resources, so that our members can stay current and to have the resources to take certification and maintenance of certification examination. The American Board of Orthopedic Surgery's job is to assess and credential orthopedic surgeons in the best interest of the public, so the public can be assured that if they see a board certified orthopedic surgeon, that they know they have a minimum level of expertise demonstrated through cognitive testing and a four-part process. So the Academy's job is the education, and the board's job is certification and maintenance of certification. I think we're all learning more and more about the power of partnership for the AAOS and the ABOS. Again, I think due to a lack of understanding, the two organizations didn't realize the importance and the credibility of working in our lanes, but together, so that our fellows, the diplomates of the board, had confidence that this process was worthwhile, was valid, and they had an opportunity to study accordingly. And so the fact that now the two organizations are working closer together, I think just lends even more credibility to the process and the need for ongoing maintenance of certification.